Good afternoon, everyone. The subcommittee will come to order. I'd like to welcome members who are joining us today remotely. Those members are reminded that they must be visible on screen within the software platform for the purposes of identifying and verification when joining the proceeding, establishing and maintaining a quorum, participating in the proceedings, and voting. Members participating remotely must continue to use the software platform's video function while attending the proceedings unless they experience connectivity issues or other technical problems that render the member unable to fully participate on camera. If a member who is participating remotely experiences technical difficulties, please contact the committee staff for assistance and they will help you get reconnected. When recognized, video of remotely attending members' participation will be broadcast in the room and via the television internet feeds. Members participating remotely are asked to mute their microphones when they are not speaking. Doing so will help to ensure that the remote technology works properly. Members participating remotely will be recognized normally for asking questions, but if they want to speak at another time, they must seek recognition verbally. In all cases, members are reminded to unmute their microphone prior to speaking. Members should be aware that there is a slight lag of a few seconds between the time you start speaking and the camera shot switching to you. Members who are participating remotely are reminded to keep the software platform's video function on for the entirety of the time they attend the proceeding. Those members may leave and rejoin the proceeding. If members depart for a short period for reasons other than joining a different proceeding, they should leave the video function on. If members will be absent for a significant period or depart to join a different proceeding, they should exit the software platform entirely and then rejoin if they return. Members are also advised that I have designated a committee staff member to, if necessary, mute unrecognized members' microphones to cancel any inadvertent background noise that may disrupt the proceedings. Members may use the software platform's chat feature to communicate with staff regarding technical or logistical support issues only. Finally, remotely participating members should see a 5-minute countdown clock on the software platform's display. But if necessary, I will gently remind members when their time is up. For the purpose of voting, remote members are reminded that they must unmute themselves to vote. For voice votes, I will pause for a few seconds when asking for yes and no votes to ensure remote member votes have been heard. If we have a roll call vote, remote members are requested to both say their name and how they are voting. Doing so will help ensure the clerk can properly record your vote. Remote members must be visible to me on the screen in order to vote. Remote members who experience connectivity issues or other technical problems that render the member unable to fully participate on camera will not be able to vote. Okay, you are all there. We are all here. We will begin our proceedings now. This year's markup process has certainly been unique. That said, the subcommittee mark was produced in a bipartisan manner and is inclusive of many members' priorities, which I will highlight below. This subcommittee's priorities has always been to take care of service members and their families, and we continue to do so in this year's mark with a military basic pay raise of 3%, as well as authorizing the Secretary of Defense to pay a basic needs allowance for low-income service members. The mark also includes improvements to the Exceptional Family Member Program by requiring the Secretary of Defense to standardize the program across all services to include requiring the services to hire lawyers with experience in education law to advocate for families in their states. The subcommittee continues to provide authorities to improve the department's child care program by requiring child care services on a 24-hour basis at installations where there is shift work. The mark also requires the Secretary of Defense to define military family readiness and resiliency and implement a communication strategy to better communicate with family members. The mark establishes a domestic violence task force with experts to help formulate improved policy and prevention efforts to reduce incidents of this heinous crime. I am pleased the mark includes the requirement for the Secretary of Defense to prescribe regulations for a, quote, safe to report, unquote, program, which will reduce the fear victims have of reporting sexual assaults. The mark also includes a requirement for a tracking mechanism and reporting requirements for supremacist, extremist, and criminal gang activity in the armed forces. The subcommittee continues to provide oversight over the military health system reform by prohibiting the realignment or reduction of authorized military medical end strength for 1 year after the date of the enactment of this act, requiring more analysis that includes the military health system's role for homeland pandemic response. The mark also delays the implementation of moving retirees and family members out of military treatment facilities until 1 year after the implementation plan is submitted to Congress. Finally, in response to COVID-19, the subcommittee mark includes several provisions to ensure the department is postured and prepared for future pandemics with the appropriate diagnostic testing capability, protective equipment, and research capability on hand to protect members of the armed forces from the threat of infectious disease, as well as surge capacity to assist citizens of our nation if required. As I've stated many times, when the service member serves, so does his or her family. They make sacrifices for our nation, and we must continue our commitment to care for them. Lastly, I want to acknowledge the Herculean staff's efforts under extraordinary circumstances. Craig Green, David Cicchetti, our newest member of the team, Hannah Kaufman, Glenn Deal, and Daniel Stites, all of whom worked in a bipartisan manner to develop the mark. This year will be added the challenge of building it remotely. We thank you very much for your efforts. Chair now recognizes Mr. Kelly, the ranking member on the subcommittee, for any opening comments he may make.
I thank the chairwoman and my fellow subcommittee members for their dedication and hard work that went into this mark, especially amid the COVID-19 pandemic. I also want to thank the chairwoman for working with me to include the provisions of the Family Readiness Standalone Bill introduced by Ranking Member Thornberry and me earlier this spring. I'm pleased that the subcommittee mark we are considering builds upon many of the important reforms this committee has dedicated itself to in previous NDAAs. The mark includes vital provisions that support our warfighters, military families, and retirees and gives them the care and support they need, deserve, and have earned. Specifically, this year's proposal continues to rebuild and grow the armed forces, including increases in end strength for the Army and Navy, and for the first time, the Space Force. And there is also a requirement for a detailed report on the force structure plan of the Space Force. This proposal also includes an extension of special pay and bonuses for service members in high-demand fields and supports a military basic pay raise by 3%. The mark continues the committee-dedicated work to support of the military family. The mark requires the Department of Defense to redefine military family readiness and military family resiliency, as well as implement a strategy to better communicate with military families, and develop a biannual survey that measured the effectiveness of the department's programs in areas like education, spousal employment, and military health care. This mark requires the standardization of the EFMP, Exceptional Family Member Program, to include the process for identifying and enrolling participants, enhance the respite care benefit, establish outcome measures, and improves the screening process for the evaluation of duty stations that can support EFMP enrollees. It also improves the PCS process so that as soon as notification of orders are provided, an EFMP coordinator will begin working with a family on their needs at the new installation and begin coordinating specialty appointments through TRICARE. The proposal requires the department to provide specific, actionable information on the amount of funding needed to hire and retain behavioral health professionals for active duty and all other TRICARE beneficiaries. The proposal also requires an action plan on the use of telehealth for behavioral health and other similar medical disciplines. Another important section in the proposal is a study that would require the Department of Defense to examine the feasibility of authorizing a spouse to contribute to the thrift savings plan account of their service member's spouse. If feasible, this may be very helpful to many military families. The proposed mark requires the Secretary of Defense to establish a military civilian task force on domestic violence with experts from within the Department of Defense, Department of Justice, Department of Health and Human Services, and Centers for Disease Control and Prevention, as well as civilian expert. It also requires the department to collect information on the prevalence of domestic violence involving members of the armed forces, their intimate partners, and immediate family members. The proposal also includes several provisions addressing the COVID-19 pandemic that has gripped virtually all parts of military and the society. It requires the department to ensure that the armed forces have the diagnostic equipment, testing capabilities, and personal protective equipment necessary to protect service members from the threat of infectious disease and to treat members who contact infectious diseases. It also requires a national security strategy to include the provision of drugs, biologics, vaccines, and other critical medical equipment to ensure combat readiness and the safeguarding of the health of the armed forces. The proposal also requires a report on the critical vulnerabilities in the medical supply chain of the United States. Finally, the proposed remark would continue to build on critical reforms in previous NDAs, including refining sexual assault prevention and response programs, providing additional oversight of the military health system to include prohibiting further realignment of military medical in strength until a review of medical manpower requirements includes homeland defense missions and pandemic influenza, and the proposal limits the realignment of certain military treatment facilities until further information is considered on the impact on beneficiaries and the capacity of local health care workers. In conclusion, I want to thank Chairwoman Spear and my colleagues on the subcommittees for their considerable work on this mark. Likewise, like our Chairwoman, I want to give a special thank you to our staff on the minority, Glenn and Paul, and on the majority, Craig, Dave, Hannah, and Danielle, who worked in a bipartisan manner in support of all the members of the Military Personnel Subcommittee. Thank you, staff members. Personally, we could not do this without your help. I yield back.
Thank you, Ranking Member Kelly. It's been a pleasure working with you this year on a number of issues. Excuse me. And I truly have enjoyed the visits we made to the bases. All right, we will move forward now on the consideration of the subcommittee mark. H.R. 6395, the National Defense Authorization Act for fiscal year 2021. Without objection, the first reading of the bill is dispensed with. Copies of our subcommittee mark and directive report language were made available and distributed to members' offices on Thursday, June 18th. Is there any discussion or questions on the subcommittee mark? If there is no further discussion, the chair lays before the members the text of the subcommittee mark for consideration. Without objection, the mark is open to amendment at any point. Are there any amendments to the subcommittee mark? Any amendments? Seeing none, we will now move to the question now occurs on the adoption of the mark. So many as are in favor will say aye. 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 Those opposed, no. The ayes have it, and the mark is adopted. A roll call. Pardon me? Tab 7. The chair now recognizes the gentleman from California, Mr. Cisneros, for purposes of a motion.
Madam Chairwoman, I move that the subcommittee report the mark favorably to the full committee.
The question is on the motion of the gentleman from California, Mr. Cisneros. So many as are in favor say aye. Aye.
Aye.
Those opposed? A quorum being present, the ayes have it, and the motion is adopted. And without objection, a motion to reconsider is laid upon the table. Without objection, members have 5 legislative days within which to submit written statements into the record. So ordered. I also ask unanimous consent that staff be authorized to make necessary conforming technical and clerical changes and to remove from the mark provisions that would cause the mark to refer to other committees or would result in additional direct spending or would result in an earmark. Without objection, so ordered. There being no further legislative business before the subcommittee, this meeting is adjourned.